Thank you. I call the member for Bega.
Thank you, Madam Assistant Speaker. I'm pleased to rise to make a short contribution to support the Public Health Tobacco Amendment Bill number 2, 2024. This bill responds to community expectations from the New South Wales Government to urgently respond to the soaring rise in illicit tobacco trade, which is targeting young and vulnerable people in our community. I note that the parliamentary inquiry into e-cigarette regulation and compliance in New South Wales, conducted by the Committee on Law and Safety, recommended that a positive licensing scheme be introduced to support comprehensive and targeted enforcement. Now, the tobacco licensing scheme introduced by this bill will ensure that New South Wales has accurate, up-to-date information on tobacco retailing and wholesaling activity across the state. Every retailer and wholesaler selling tobacco products in New South Wales will need to have a licence, with all licensees required to renew their licence every year. The bill will give the Health Secretary the power to reject an application or revoke an existing licence if the applicant has been convicted of an offence relating to the sale or supply of tobacco or vaping goods under the relevant Australian legislation. Now, from 1st of July 2024 to 30th of September 24, New South Wales health inspectors seized more than 3.2 million cigarettes and over 600 kilograms of other illicit tobacco products, with an estimated value of over $3.7 million. And year on year, the seizures of illicit tobacco have continued to rise. This scheme will support comprehensive and targeted enforcement to identify and penalise those retailers and wholesalers doing the wrong thing. That's why this government is aiming to commence this much needed scheme around the 1st of July next year. The cost of a licence will be set by way of regulation. However, it is anticipated to be $1,100 per year for each premises for both retailers and wholesalers. These fees will cover the cost of developing, implementing and enforcing the licensing scheme on a cost recovery basis and ensure the proper implementation of the scheme. Tobacco licensing has become the norm in Australia. All other states and territories either already have an equivalent scheme in place or are in the process of developing one. A positive tobacco licensing scheme in New South Wales will create a level playing field across all jurisdictions. A licensing scheme in New South Wales will also act as a deterrent for tobacco retailing businesses seeking to operate outside of the law. This bill includes penalties of up to $220,000 for corporations and $44,000 for individuals selling tobacco without a licence under the new scheme. This new initiative will ensure greater oversight of the tobacco retail industry, and it will make it more difficult for illicit tobacco to flourish in New South Wales. We must act now. Speaker, I've been pleased to speak on the Public Health Tobacco Amendment Bill 2024, which provided a platform in order to ensure enforcement of supply and possession of vaping goods and e-cigarettes to protect young people from the harms of vaping and the gateway to tobacco smoking. I also believe that this bill will have important public health implications. Smoking kills people, smoking disables people. It causes stroke, heart attack, lung disease. It causes numerous cancers from the upper respiratory tract to the lung, as well as increasing the risk of bladder and cervical cancers. It increases the complications of pregnancy, from miscarriage to stillbirth. As long as this filthy, lethal habit remains legal, governments must reduce harms from this addiction. This bill will help control supply and reduce demand, and I commend this bill to the House.